Hi, I'm a general pediatrician, and today we're going to talk about dealing with infant reflux or GERD. Reflux is very common in infants. It's estimated that 30 to 50% of infants will have some form of reflux, and most of those infants will get better by the time they are 1 year old. Some infants will have more significant reflux, and that can lead to what we call a pathological or clinical or a complicated reflux. And that's when your child might need to see a specialist. But most of the time, it's pretty easy for you to take care of your infant at home. So how do you know if your baby has reflux? Well, first off, they might spit up a lot. So they might spit up after every feeding. You might have an infant who spits up multiple times a day and has a lot of difficulty settling or going to sleep. They may also have a lot of gas pains. And by that, I mean a lot of fussiness, especially in the late afternoon or evening. Sometimes we'll see infants arch their back or pull their legs up towards their chest. That's also a sign that they might be in pain from gas or from reflux. The first thing you want to do is make sure that your infant is eating appropriately. So if you're breastfeeding, make sure that your latch is good and that your infant is getting enough breast milk. If you're doing formula, make sure you're using the right formula and the right amount of formula. Often we'll see that overfeeding can actually make reflux worse. So if you're doing bottles, try not to overfill the bottle and only give your infant the amount of formula they can actually drink. The next thing is to make sure your infant is burped frequently and well. So this is something that parents can find really frustrating because sometimes it seems like no matter how much you burp your infant, they just won't get rid of their gas. There are multiple ways to burp an infant. You can do it by putting them over your shoulder and patting their back or rubbing their back. You can also do it by putting them in a seated position and gently rubbing their back. Sometimes infants do better being held in a vertical position rather than a horizontal position. And sometimes you can use things like a pacifier to help get the gas out. If you're concerned about your infant's latch, that can cause them to swallow a lot of air, which can make reflux worse. Also make sure that your infant is not getting too warm, because that can also worsen reflux. If these things aren't helping, there are some things that you can add to the routine that might be helpful. First off, you can thicken the formula. By doing this, we slow down how fast the formula empties from the stomach into the intestines, and that gives the infant's stomach a chance to relax and empty more easily. You can do this by adding what's called a rice cereal to the formula. The brand that we like to use is the Earth's Best Rice Cereal. We like this one because it's iron fortified. There are other brands available. You can also add this to breast milk. Just add a little bit at a time until you reach the consistency that you desire. You don't want to make it too thick because that can make it harder for your infant to eat. You also don't want to add anything else to the formula or the breast milk, like oatmeal or baby food, because that doesn't have the right consistency and it can actually be dangerous for your infant. Another thing you can do is give your infant smaller, more frequent feedings. So if you're giving your infant 6-ounce bottles every 4 hours, try giving them 4-ounce bottles every 3 hours. Smaller feedings are easier for your infant to manage and can help reduce the amount of reflux that they have. Lastly, you can change the position that your infant sleeps in. So infants who have reflux tend to do better sleeping on their stomachs or on their sides. You can put your infant to sleep in a safe sleep environment. Make sure that the crib is bare, no loose blankets or pillows, and that the mattress is firm. If these things don't work and your infant is still having a lot of pain, then it's time to follow up with your pediatrician. Your child might need a referral to a specialist to get an endoscopy and do what is called a pH monitoring to evaluate how severe the reflux is. And they might need medications to help with their reflux. I hope this video was helpful to you. Reflux can be very frustrating for you and for your infant. And sometimes it can be hard to know what to do. So hopefully this gives you a good place to start. And as always, If you have any concerns about your child's health, make sure you talk to your pediatrician. We're here to help,